Welcome. I am Elaina Osterbur. I'm a professor at St. Louis University, and we're glad you're here for older adults and infectious disease outbreaks, a syndemic and age-friendly perspective. I hope what you learned today informs and inspires your work. Before we begin, we need to fulfill our GWEP grant requirements by sharing with you that the project is supported by HRSA for our GWEP program. So before we get started, let's begin to assess what you already know. So if you want to take a few moments to answer the following questions based on your current knowledge and experience, and then at the end, we will revisit these again. By the end of the session, you will be able to describe the biological and social vulnerabilities of older adults during infectious disease outbreaks, explain how social determinants of health and the concept of syndemics increase infection risks and health inequities, identify strategies to prevent, manage, and respond to infectious disease in older populations, apply the forum's framework, which is what matters, medication, mentation, mobility, to age-friendly infectious disease planning, and also to analyze case examples from outbreaks such as COVID-19, influenza, and RSV. The Forum's framework is a cornerstone of the Age-Friendly Health Systems Initiative designed to ensure that care for older adults is safe, evidence-based, and centered on what matters most to them. The framework focuses on four essential elements, the four M's that we discussed in the previous slide, that should be consistently addressed in every healthcare interaction with older adults. The four M's work together as a set. Integrating these areas ensures comprehensive, person-centered care that promotes healthy aging and avoids age-related harms. The social determinants of health are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, live, work, and age, and they significantly shape overall health and well-being. The social determinants of health matter because they account for up to 80% of health outcomes, while medical care accounts for only a small portion. So addressing the social determinants of health is essential to achieving health equity and improving population health. They help explain why some groups experience better or worse health than others, often due to structural inequities. For example, a person living in a safe neighborhood with access to healthy food, quality education, reliable transportation, and supportive social networks is more likely to experience better health than someone lacking those resources, regardless of their clinical care access. So, what is the integration of the four M's and the social determinants of health? It happens when we recognize that what matters is shaped by cultural values, financial constraints, housing, and access to care, which are the core elements of the social determinants of health. Cultural background can shape priorities around autonomy, family involvement in care, end-of-life decision, and also health beliefs. Limited income may prevent individuals from assessing preferred services such as home care versus institutional care. A person's living situation impacts their ability to age in place, access services, and feel safe and respected. Health goals are only meaningful if individuals can access providers who listen, who communicate effectively, and provide appropriate options. For example, an older adult may prefer home-based care, but without transportation, in-home services, or insurance coverage, that preference may not be honored. Medication management can be affected by income and the ability to afford prescriptions, as well as having health literacy to understand medication management and also having pharmacy access. Many older adults skip doses or do not fill prescriptions due to the high out-of-pocket costs. Limited understanding of medication instructions can lead to misuse, overuse, or non-adherence. Living in a rural or underserved urban area may lack nearby pharmacies or delivery services. For example, an older adult may be prescribed multiple medication but lacks the means or understanding to manage them safely, leading to adverse drug events or hospitalizations. Mentation or cognitive health is impacted by social isolation, educational level, and community support. For example, mentation is influenced by social isolation. Loneliness alone is a major risk factor for depression and cognitive decline, especially after retirement or widowhood. A person's education level may reduce awareness or early recognition of cognitive changes. The availability of community support services such as adult day programs, dementia-friendly community resources, or caregiver support can increase caregiver burden and worsen outcomes. For example, an older adult living alone with mild dementia may lack access to early interventions simply because there are no nearby resources or screening services. Mobility can also decline due to unsafe neighborhoods, the lack of transportation, or poor access to assistive devices or rehabilitation services. Mobility is influenced by neighborhood safety. The fear of crime, the lack of sidewalks can deter walking or outdoor activity. The access to reliable transportation may cause older adults to miss therapy appointments or be unable to obtain assistive devices. Also, the access to rehabilitation or assistive technology because of financial or geographic barriers may prevent access to walkers, cane, physical therapy, or even home applications. For example, a patient who experiences a fall but cannot access physical therapy due to lack of insurance or transportation may suffer preventable functional decline. So, what is a syndemic? The syndemic is a concept in public health that describes a synergistic interaction of two or more diseases or health outcomes, which are worsened by social, economic, and environmental factors. And we're going to see a video here in a second. And although the story in the video centers on younger individuals, its lessons resonates throughout the lifespan. So I'm going to stop share here. And I'm going to share my screen again.
In this video, we are going to talk about syndemics, which is a new term for many people. To help us understand what a syndemic is, we are going to introduce you to Andre. Andre is a 32-year-old African-American, same-gender-loving man. Andre enjoys being sexually active and has had multiple partners. He is HIV positive and was recently diagnosed with syphilis. Andre lives below the poverty line and is currently unhoused, sleeping on friends' couches or at shelters when there is nowhere else for him to stay. He doesn't have health insurance, but is looking into the Ryan White program after hearing about it from a friend. Andre's health circumstances can be understood as part of a syndemic. But what is a syndemic? A syndemic is the clustering of two or more health issues within a population due to social and structural factors and inequities, leading to increased harmful effects on the health of communities and their members. These health issues and social conditions are intertwined and cannot be adequately addressed by themselves. Let's examine how Andre and his interacting health and social conditions illustrate the syndemic affecting his community. An important element of syndemics is that the health issues worsen each other. In Andre's case, the presence of another sexually transmitted infection, or STI for short, can increase the viral load of HIV in Andre's body, making it more challenging to control the virus through antiretroviral therapy. This can lead to a weakened immune system and an increased risk of opportunistic infections. Having HIV can cause major stress. This, combined with a new STI diagnosis, can affect Andre's mental health. He may experience anxiety, depression, or fear of transmitting the infections to his partners, which can affect his overall well-being. Andre also experiences social, structural, and environmental factors that influence and interact with his health conditions. These factors can have a negative impact on his health. Andre lives below the poverty line and does not have health insurance. This makes it challenging to access healthcare, support, and treatment. He has a hard time affording transportation to medical appointments or to the pharmacy to pick up medication. Delayed treatment can cause both diseases to progress and further complicate each other. Nutritious foods can be more expensive than empty calories, so he picks less nutritious options. Less nutritious foods can weaken his immune system and make it more difficult for his body to fight HIV. Living in poverty and not having health insurance lead to chronic stress, which further reduces his motivation to seek HIV care, adhere to treatment, and engage in healthy behaviors. Andre experiences stigma and discrimination related to his HIV status, his race, and sexuality. This, in turn, impacts his comfort and ability when it comes to accessing healthcare and support, often causing him to miss appointments for fear he will be judged or treated poorly. He is also unhoused, which impacts his mental health and ability to store his HIV medication, making it challenging to take his medication as prescribed. Andre's case demonstrates the interaction and amplification of multiple health and social factors that characterize a syndemic. Understanding syndemics is a step toward designing comprehensive interventions that address the complex interplay of health issues and social factors in order to improve the overall well-being of people, including Andre.
I'm going to stop share here and we'll go back to our slides. I hope that all of you enjoyed that video as well. And I wanted to point out too that even though Andre was 32 years old and he has HIV, that HIV is also something that affects older adults. According to HIV surveillance report from the CDC, of the nearly 1.1 million people living with diagnosed HIV in the US and dependent areas in 2021, about 41%, which is roughly 450,000 people, were age 55 and older. So many of those HIV risk factors are the same for people of any age, but older people are less likely to get tested for HIV. Treatment with HIV medicines called antiviral therapy, or ART, is recommended for everyone with HIV. As for anyone with HIV, the choice of an HIV treatment regimen for an older person is based on a person's individual needs. Similar to older people without HIV, many older people have health conditions such as cardiovascular disease, diabetes, renal disease, and cancer that can complicate HIV treatment. Okay. So why are older adults more vulnerable to infectious disease and other health conditions? So we're going to look at both biological and social factors that play significant roles. Here, immunosenescence, or the gradual decline of the immune system with age, increases susceptibility not only to infectious diseases, but also to chronic conditions such as heart disease, diabetes, and chronic obstructive pulmonary disease, or COPD. Additionally, many older adults take multiple medications, which increases the risk of harmful drug interactions and contribute to further health decline or even mortality. Social factors can also contribute significantly to increased vulnerability among older adults. Living in congregate settings such as nursing homes elevates the risk of exposure to infectious diseases such as RSV, influenza, and COVID-19. When an outbreak occurs, residents are often placed in isolation to contain the spread. which can lead to unintended consequences such as social isolation. This isolation may contribute to mental health concerns, including depression and anxiety. These effects can be compounded by limited access to transportation and healthcare services. Additionally, many older adults face technological barriers, such as lack of access to smartphones or the internet, which further restrict their ability to maintain social connections and access critical resources. So here are a few examples of how infectious diseases impact older adults. COVID-19, for example, disproportionately increases mortality among older adults in long-term care settings. The resulting isolation from loved ones during this time was particularly devastating, especially for individuals with limited digital literacy or access to technology like smartphones and tablets. Furthermore, prolonged inactivity during illness or quarantine can accelerate loss of mobility and cognitive decline. Other respiratory illnesses, such as influenza and RSV, pose similar risk to older adults. For this reason, it is essential that older adults receive annual vaccinations against COVID-19, influenza, and RSV to reduce severe outcomes and also to protect overall well-being. So let's return to the forum's framework to guide our approach to infectious disease planning for older adults. Start by asking what matters. Ensure that care aligns with each older adult's values and goals, especially during public health crisis. As a healthcare provider, take the time to engage in meaningful conversations with your patients about their priorities during these outbreaks. Review medications carefully for appropriateness, avoiding those that may suppress the immune system or also increase fall risk. Routinely screen for cognitive changes such as delirium, depression, or dementia. Encourage mobility whenever possible, even during quarantine or isolation. Promote safe movement to help prevent deconditioning and to maintain function. So prevention, preparedness, and response strategies are important in protecting the health of older adults. Some of those initiatives might include tailored vaccination campaigns. Design vaccination initiatives specifically for older adults by offering vaccines in convenient and familiar settings, such as senior centers, churches, long-term care facilities, by creating culturally and linguistically appropriate education materials, by addressing vaccine hesitancy through trusted messengers such as clinicians or faith leaders, peers as well, and scheduling mobile clinics and home visits for those who are living at home. Telehealth for monitoring and check-ins. Telehealth helps maintain regular health monitoring while reducing exposure risk. Training older adults in how to access telehealth. Telehealth enables remote symptom tracking and medication management as well. It facilitates follow-up care for chronic conditions that are impacted by infectious diseases. It reduces the burden of transportation and mobility barriers and offers emotional support and mental health check-ins during isolation. Infection control in home and facility-based settings. Robust infection control policies are essential in all care environments. Train caregivers and staff in proper hygiene, PPE use, and symptom surveillance. Implement vaccination improvements, cohorting practices, and regular testing in congregate settings. Educate family members that are providing care at home on infection prevention best practices. Supportive policies refer to laws, regulations, funding mechanisms, and institutional practices that are intentionally designed to improve the health, safety, and quality of life of a specific population. In this case, we're talking about older adults. Fund public health preparedness programs targeting aging populations. Policies that strengthen regulatory oversight of long-term care facilities and incentivize vaccination and prevention programs in Medicare and Medicaid. Paid caregiver leave policies protect both formal and informal caregivers. It allows family caregivers to take time off without risking employment or income. Caregiver leave can reduce disease transmission by enabling symptomatic caregivers to stay home. Paid caregiver leave promotes continuity of care by decreasing caregiver burden, burnout, and also turnover. Broadband access for seniors or digital equity is essential for modern healthcare delivery. By expanding affordable broadband access to low-income or rural seniors, healthcare accessibility can be achieved. There is a need to provide digital literacy training and access to devices and enable access to telehealth, online support programs, remote education, and social connection. There is a need to increase availability and convenience of vaccination by limiting out-of-pocket costs and streamline enrollment in vaccine programs. One method to expand it is to offer vaccines during routine care visits and through community outreach, and to ensure pharmacies and clinics are accessible to individuals with mobility or transportation limitations. Team-based care enhances coordination and cultural competence. Interprofessional teams like nurses, pharmacists, social workers, physicians, etc., can address complex medical and social needs. Community health workers also bridge gaps in care in conducting home visits, delivering health education, and connecting patients with resources. Both approaches increase trust and compliance, especially in underserved communities. To support recovery and build resilience, communities and healthcare systems must promote re-engagement with social and community life following periods of isolation. It is essential to address grief, loss, and mental health needs while also advocating for system-wide, age-friendly, and equitable public health policies. In conclusion, aging adults face overlapping biological and social risks. The social determinants of health, syndemics, and 4Ms are the key to reducing harm and improving outcomes. So the references. And if you have any questions, you can contact me here. And let's look at those questions that were posed to you in the very beginning. And I think you all have the answers. But let's address each one. Number one, how do the social determinants of health affect 4Ms of age-friendly healthcare? Social determinants of health, such as income, education, housing, and access to care, significantly influence how effectively the 4Ms are addressed. What matters? Personal goals and care preferences may be shaped or limited by financial stress, cultural values, or housing insecurity. Medication, low income or limited pharmacy access can lead to skipped doses or harmful polypharmacy. Then we have mentation, social isolation, low health literacy, and poor access to mental health services increase risks of depression, delirium, and dementia. Mobility, unsafe neighborhoods, lack of transportation, or unaffordable assistive devices limit safe movement and function. Number two, why are older adults more vulnerable to infectious diseases? Older adults face increased vulnerability to biological and social factors. And I'll let you read those in the notes. And also, what is a syndemic? Number three, the syndemic is a synergistic interaction of two or more health conditions that are worsened by social and structural inequities. For example, COVID-19 plus diabetes plus poverty equals worse outcomes than any condition only. Syndemics highlight how disease and disadvantage interact, particularly in marginalized populations like older adults. Number four, what is the impact of infectious disease on older adults? Infectious disease can have severe consequences for older adults, higher rates of hospitalization and mortality, increased risk of functional decline, cognitive impairment, and social isolation, disruption of routine care and caregiving support, long-term effects on mental health, mobility, and independence. Number five, how do we prevent, prepare, and respond to infectious diseases in older adult communities? A comprehensive approach might include Prevention. We want to be able to prevent disease, routine vaccinations, infection control education, and addressing the social determinants of health. Preparedness by tailored emergency plans for older adults, telehealth, infrastructure, staff training, and also the stockpiling of PPE. Response, we want rapid outbreak detection, coordinated care using interprofessional teams, mental health, and mobility support, and age-friendly communication strategies as well. So I hope you were able to get all of that. And I'd like to thank all of you very much. And also, if you would take a moment to please fill out this evaluation for our grant reports. Thank you very much.